Opening a patient chart begins with logging into the iPatient Care platform, and you can open up a patient chart by a couple of different means. You can first of all search for it in the patient selection area. You can also search for it in the upper right-hand part of the EHR, and you can also open up any previous charts that you've been in by selecting these 4 circles, and that will identify the most recent charts, and you can make that selection. So we will go ahead and open up this test Randy file. Now that his chart is open, we would like to go ahead and open up a new note. Now I'd like to direct your attention to the left-hand side of the screen below the picture, and you'll see what is called Document List. And there are 3 horizontal lines, each with a dot in them. When you click on that, it will open up the different types of notes that are developed for you or that you can go ahead and customize for your practice. In this particular instance, it defaults to the multidisciplinary office visit note, but you will also see that we have an examination note, chiropractic procedure or treatment note, medical procedure note, physical therapy note, massage therapy, so on and so forth. In addition, this is where scanned files can be stored so that you have easy access to information within the patient's record. So we will go ahead and leave this as the multi-D office visit, and that has been selected. And then we will go ahead and click the plus sign just above the provider input. When we open that up, you will see that there is a case. This is significant for keeping a patient's treatment to the specific claim that may have caused the patient's problem or condition. For instance, with motor vehicle accidents, they would require a claim only for the care that was provided from the causation of the injuries sustained. In the demographics section of the platform, a case would be assigned, and so you'd be simply selecting that case based on the reason why you're seeing the patient. Next, you will see the date. It will automatically default to today's date. If you, for some reason, are doing a record for the previous days, you would go ahead and select that date. However, you cannot have a record started beyond today's date. Next, you will see the time automatically is entered. Then you will see the provider, and this will be defaulted to the individual provider who's a user in the system. If there are multiple providers in the system, this would drop down and you could select other providers. Next, you will see a co-signatory. This would be for primary care providers who have levels of supervision requirements over other types of mid-level providers who may be treating the patient. And then finally, your location. The referring provider, back to the left-hand side of the screen, can be entered or searched based on your database of referring providers that you may have. And then, of course, the office visit, place of service, and that this is a new or established patient. This will be automatically determined. And so we will go ahead and click OK down on the lower right-hand part of the screen, and that opens up our patient visit note. So let's learn about how the note functions and operates.